Yeah.
Today we are going to discuss about lupus nephritis. So first question,
I got it.
what is lupus nephritis?
Okay, so the kidney involvement in SLE is lupus nephritis. Okay, simple. It
Okay.
can be of various severity and various types.
Okay. And what are the symptoms of lupus nephritis?
Yeah, see, it can come de novo, it can come while you have SLE, it can come during remission, it can come anytime, it can come as a first presentation, it can come during a flare, it can come as an additive thing as you get joint pain, rash, neurological symptoms, seizure. If there is a flare, it can be a silent lupus nephritis. It can come as a renal failure, complete kidney has packed up, either as an acute one or a chronic one, and it can be detected later also. Patient are already on dialysis due to some unknown cause. Somehow they have missed lupus, and subsequently when they have a flare, then you realize, oh ये तो lupus ही है, किडनी ट्रांसप्लांट होने के बाद भी ऐसा हो गया. मतलब कई रूप से आ सकता है.
So if we want to see कि what are the symptoms, ऐसा क्या होता है कि हमें आइडिया लग जाए कि ये किडनी इन्वॉल्व हो रही है इसमें, ऐसे क्या क्या
तीन चीज हो सकता है. सूजन हो जाता है पाँव में, और यूरिनेशन कम हो जाएगा, पूरा बॉडी ब्लोट हो जाएगा. और कभी कभी क्या होता है, उसका कॉम्प्लिकेशन हो जाएगा, या तो किडनी काम करना बंद होके सांस फूल जाएगा, या ब्लड टेस्ट में क्या है, या तो यूरिया क्रिएटिनिन बहुत ज्यादा बढ़ जाएगा, या पोटेशियम बढ़ जाएगा कि तुरंत डायलिसिस करना पड़े, या तो बार बार यूरिनरी एब्नॉर्मलिटी होगा. मतलब यूरिन में प्रोटीन चलता रहेगा, और सब लोग ऐसे ही देखते हैं. अक्सर ऐसा हो जाता है, जो लूपस में होता है, माइल्ड सा एवेलुएट करने वक्त 3+ प्रोटीन हो जाता है, तब डॉक्टर बोलते हैं बायोप्सी करना है, किडनी बायोप्सी. सो पेशेंट ने बोला नहीं ये अच्छा डॉक्टर नहीं है, शिफ्ट कर देते हैं. सो वो मिस हो जाता है. देन फिर किडनी खराब होने के बाद अगेन लूपस के पास, डॉक्टर के पास आते हैं.
एंड सर व्हाट इज किडनी बायोप्सी? सब डरते हैं नाम से कि बायोप्सी कोई बड़ी सी चीज होगी, तो ये होता क्या है?
कुछ नहीं है, कुछ नहीं होता है. ये जैसा भी इंजेक्शन डालते हैं कोई भी ब्लड टेस्ट करने के लिए, और स्किन में रैश में होने से हल्का सा बायोप्सी करते हैं. सो किडनी थोड़ा पीछे रहता है, आगे नहीं रहता है, एकदम पीछे रहता है, हाँ, कंबर के नीचे रहता है. आजकल क्या है, अल्ट्रासाउंड गाइडेंस में छोटा सा टुकड़ा निकाल के डालते हैं. 100 में एक आदमी को कॉम्प्लिकेशन होता है कि वो अगर वेन्स में लग जाता है तो पेशाब में एक दिन के लिए खून आता है. दैट्स ऑल. ऐसा कुछ जान नहीं जाता है, बट कभी कभी प्रॉब्लम हो सकता है. मतलब 1 लाख में 1 करोड़ प्रोसीजर रिलेशन कॉम्प्लिकेशन हो सकता है. सो पेशेंट के अनुमति के बिना वो लोग करते नहीं है. सो कई पेशेंट मेरे पास अबाउट 60 to 70% मना कर देते हैं. मैं पेशेंट को मान लेता हूं, बट कई डॉक्टर, वो गलत नहीं है थोड़ा बहुत, कई डॉक्टर थोड़ा बोल के फोर्स करके बायोप्सी करवा देते हैं. वो मोर साइंटिफिक है. मैं इसमें थोड़ा मैं आई एम डिफरेंट. आई जस्ट लीव इट बिकॉज नाउ गुड मेडिसिन ऑफ लव.
ओके, ऑलराइट. सर ये जो बियॉन्ड आवर सिटिंग के बाद जो लेग्स में स्वेलिंग आती है, इज इट रिलेटेड टू किडनी और जस्ट अ कॉमन थिंग?
ना, लेडीज को वैसे भी किसी कारण से होता है, उनका वैस्कुलेचर थोड़ा नरम होता है. सो अगर गर्मी में ज्यादा देर बैठने से वीनस स्टेसिस से हो जाता है. और दूसरा पीरियड्स के टाइम में थोड़ा कभी कभी 3-4 दिन जब बॉडी वाटर रिटेंशन होता है तब भी सूजन हो जाता है. और जो मोटे औरत है जिसका 70-80 किलो होता है उसको भी हो जाता है, डायबिटिक में हो जाता है. सो लेग स्वेलिंग आम कंप्लेंट है, बट इसमें क्या है, बहुत बड़ा हो जाता है. मतलब 15-20 किलो वेट बढ़ जाता है, तब पंगा है. हल्का सा थोड़ा बहुत, अब पूरा दिन बैठे रहते हैं, खड़े रहते हैं, हल्का सा शाम को थोड़ा फुटवेयर टाइट होने में पंगा नहीं है, मतलब डरना नहीं.
Okay. So, is it possible that like I have a locomotor disability, I cannot walk, so most of the hours I'm sitting, so am I more prone to kidney failure?
ना 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 ना, ऐसा कोई संबंध ही नहीं है। ये बिल्कुल रॉकेट और शिप के ऊपर है, मतलब कोई रीजन नहीं है। एक ही रीजन है, अगर आप कंट्रोल में नहीं है डिसीज तो लूपस नेफ्राइटिस आएगा।
Okay. So, what are the lifestyle changes that should be followed while we have lupus nephritis?
यार सिंपल है, वो बहुत ही सिंपल है। कुछ कंट्रोल करना है प्रोटीन का। कैसा कंट्रोल करना है? दवाई लेना है, जो भी दवाई लेते हैं वो लेना है। बीपी कंट्रोल में रखना है, और किसी का रीनल फेलियर हो, डायलिसिस में हो, या थोड़ा क्रिएटिनिन बड़ा हो, पोटेशियम रिच फूड्स नहीं लेना है, जैसा डेट्स हुआ है, लाइम जूस हुआ है, वो नहीं लेना है। और फ्लूइड को थोड़ा कंट्रोल करना है, मतलब 2 लीटर लेना है, बस ज्यादा फ्लूइड नहीं करना है। और उल्टा पुल्टा आयुर्वेदा सिद्धा वो करने से किडनी आउट पैक हो जाएगा, वो नहीं लेना। बस जो भी दवाई है वो प्रोटेक्टिव है।
Sir, we have Mariam Hassan with us. She has her queries. She would like to ask you some of her doubts. Yeah, go ahead. Mariam, come here. Hello, Priya. Hello, doctor.
Hello, you tell me who you are, from where you are, what are you doing? Tell me.
Okay, I am Mariam Hassan and I'm living in Bangalore since 2007. Yeah. Yes, actually I was diagnosed in 2002 in US with SLE, and just year after I was diagnosed with nephritis. For that actually they did biopsy. What the condition, and I have class 3. Just that.
Okay.
There I did, they did give me medication, but it didn't work out. And after that, I think I was there for 7 years, and I came to India finally, and I had chemotherapy for 13 cycles, the endoxin in 2008 and 2009. Then they are given a lot of medication. I was in remission just 1 year. Again, I had this problem, and since then they are giving a lot of medication, and finally I'm on MMF, mycophenolate 5 daily twice. Lately, since December, I'm having this creatinine increased. It was 1.5, and now this year it's 1.6.
Okay.
They're giving medication, and I think my doctor right now, he said because of COVID I had, maybe it's increased due to that also. I don't know, and what's the reason for this increase lately?
The thing is, let us put it in the perspective. You are living with lupus for 20 years, okay?
Yes.
And I would rather comment on the Indian doctors who have given you a very good medication called cyclophosphamide, which has kept you in remission so long, okay? And now we have another good drug called MMF, excellent good drug. There can be very many reasons for this creatinine to climb up by 0.1. One, just maybe the lab error may be there. Number 2, as you said, any intercurrent illness may be there. Third is any medication may be there. And 4, which is unlikely, could be there, maybe the kidneys, what happens is there are 2 types of kidney involvement is there. For example, there is acute nephritis from which body recovers, but there is always some scars left behind. So this leads to progressive loss of function very slowly. Had it been due to nephritis, your creatinine would have rapidly increased. Sometimes they can increase while on therapy, when you call it as refractory nephritis, when the disease takes over the drugs. When the disease wins over the doctors and patients and takes over the drugs, then the creatinine rise is very rapid. In your case, there can be 2-3 reasons. There can be a variety of reasons, but you need to just check the creatinine. Sometimes it gradually creeps slowly 1.6, 1.7, 1.8, but then they will give some medications to bring it down. So the only thing you have to do is not to worry at all, okay, and just check your creatinine frequently, that's all. And just trust your rheumatologist. Don't go to any other doctor except rheumatologist.
No, yes, going. The other question actually you were saying Sorcept is a very good medicine. No, HCQS, I'm sorry.
Yeah, HCQS is an excellent medication, yeah.
I was on it, and because of I think they said there is a slight eye problem, so they had to stop me with HCQS. Is there?
Okay. I'll tell you what is the reason. What happens is the incidence of eye involvement is about 5 per million if you use it for 10 years. Okay. Okay, but what happens is usually the doctors are more afraid that their patient may be having a eye involvement, so they stop it early. So what you will actually do to a good eye center, because eye specialists have no clue many times, even a minor variation, because in the private setup there is a fear of litigation or loss of reputation. Let us say you really have eye involvement and we miss it, then that gets viral. So many doctors are defensive. So what happens, they said, okay, stop it, because you are generally under remission. But that is not the case. You should go to a really big eye center and do advanced eye involvement like OCT, retinopathy evaluation. And if they still say there is some eye involvement, you leave it. But if they clear you, which normally they don't, Chota Mota eye specialists will not do it. But a big eye institute like Arvind, Shankar Netralaya, LV Prasad, they will clear you, okay? Then you can restart. So it's between you and your rheumatologist and your ophthalmologist. So it's okay if you stop, it's okay if you don't stop. I personally push people to take HCQS because it's a preventive drug. It's a preventive drug. All lupus patients should have it. All lupus patients should have it lifelong.
Because my doctor was like pushing me to have it, and my eye specialist was like don't. So I was little scared that maybe I might affect my eyes, so stop it. But my doctor was like, I don't care, you can go ahead, it's just a minor problem. So
the thing is, we can only advise. Let us say I advise and you don't take it, so I can't do anything about it. Let us say I don't advise and you take it, still I can't do anything about it. It is you who are going to take it. With a small caveat that maybe there will be a side effect, but the risk and benefit you will have to weigh.
Actually, my wife is having medication of SLE lupus with Sjogren's syndrome overlap. And recently that means she has been continuing medication for the last since 2016. Okay, and now we don't have any problem. The thing is, like, is there any side effect of the medication she is having? Prolonged medication she is having since 2016. So is there any side effect like MMF, ICQS, and in fact she was having rituximab 5 times in between 1 year in gap. So is there any side effects of these drugs in the near future or in the far future? That's what I want to know. And what are the things we can do to remove any toxins or any chemicals, residue or something inside our body for this from these prolonged medications?
Yeah, the thing is, the very fact that you have a baby in spite of SLE and Sjogren's speaks that you are under remission. Okay, number one. And it is only not due to doctors or you, it is only because of medication. Rituximab, MMF and HCQS. So these medicines have given you so much of benefit. Okay, so in the unlikely event of something in the later future which we don't know, Don't worry about the past. Past is mystery, future is past is history, future is mystery, present is the gift. You are in the present, you have got a gift of a child. Don't bother, follow your rheumatologist. Even if you develop a complication which is 1 in 1 million, okay, accept the complication and follow your monitoring. That's all. Finish. Don't even think about complication. If you think, then you will get it. So you think you don't have any complication, you think you don't have a disease, you think you don't have nothing, then you will be alright. Just follow your doctors. Doctors want only one thing. They want you to be free from disease. They themselves will remove the medications if you go to the correct doctor. If you go to the bad doctor, he will give you 30 medications. The good doctor is one who will give you 2 or 3 medications. Any doctor gives about 10 medication means he is a bad doctor. That's all. He is a business-minded doctor. He is having link with the trade. So he is not a okay doctor. So remember that. Okay?
And
Change the
thank you,
doctor.
sir.
Just like you change the mobile, change the rheumatologist.
Actually, the rheumatologist we are looking is very good doctor. Actually, I
That
think
is very
the thing is, yeah. The thing is like he doesn't. The doctor like she doesn't tell anything about the like. I think she doesn't want to disclose anything. That is why we have a query.
No. See, that is a difference. Again, difference. Yeah, difference in the approach. Some doctors are less speaking. Some doctors are more speaking. Some doctors will scare you. Some doctors will not tell you the bad thing. Some doctors are very good but little aloof. Some doctors are talkative but they are very bad. So it's very difficult. There is no standard operating doctor like mobile. 12 mg, 12 GB, 8 GB RAM, nothing. Every doctor is a human being like you and me. Just like you have a good human being and bad human being, you have very good doctors, but 99.9% doctors are good because they serve the humanity. That's all. Okay. So,
Second question is, sir. Thank you, sir. Second question is, can she have COVID vaccine?
Yeah. Today only. If the steroids are less than 10 mg, she can have the COVID vaccine today only. If the steroid dose is less than 10 mg, she can have steroids today only. Today you go and get it. No problem.
And she is having MMF 2 gram per day.
No problem. MMF will affect only the T cells. You can straight away go ahead and have it. Don't reduce the immunosuppression.
Next steroid or she is having steroid 5 mg only, sir.
So she can go ahead.
Okay, sir. Thank you, sir.
Ended up with kidney failure in January. So I thought I'll ask about it, but now I think there is no point asking it. Whatever has happened. So now the thing is.
No. Yeah,
sir.
okay. No, yeah, both I will say. See, whatever has happened, so we'll take it from there. But in your case, what has happened is, because you had a continuing proteinuria, little longish. Okay, so I don't remember your initial days, but you had proteinuria right from beginning, and what you had was possibly very severe hypertension. Due to some reason, probably you had stress, you had a career and all. Your hypertension was not very well controlled due to any reason. Probably you didn't have a good physician, or you were not regular in a drugs, or probably the drugs did not suit you. Somewhere down the line, there was a mismatch in your hypertension, and this hypertension has damaged the kidney slowly over the years. Because lupus nephritis by itself would have gone into end-stage renal failure within 6 months or 1 year. Probably that was controlled because your DNA, C3, C4 was okay. But over the years, what has happened is there has been a gradual kidney damage because of multiple reasons. Little bit of lupus, little bit of hypertension, little bit of variation in hypertension. Sometimes going up, sometimes going down. Had it been little higher but stable, it would have been the same. But in your case, it was seesawing too much. So probably it didn't do well with the kidneys, and probably that is the reason. I'm just thinking aloud, but otherwise, anything would have been the reason.
Yeah. So now my query is the whole soul, you can say, vision of life has gone to transplant now. Okay. So even if I go for transplant, I had a doubt that when the system has not supported its own kidneys, how will it support a foreign material in it? So
Yeah, yeah.
according to
So,
you have
see,
got the
there
data.
are two. There are two types of problems you can face because the transplant itself is a major surgery. Okay,
Yeah.
it comes under renal replacement therapy. Means the kidney function can be replaced by three manner. One is by
Yeah.
dialysis, one is by transplant, and in early cases by medicines. Okay,
Yeah.
medicines is the best, dialysis is the worst because
Yes.
dialysis lot of complications can occur because
Yes.
it's just like going in a roller coaster every 2 days, every 2 times a week or 3 times a week, and later on it will be alternate day also. It is like a roller coaster. Dialysis is like a roller coaster, but it's a easily accessible one. While transplant, it's a major thing, it's a major procedure. Okay, two things can happen in lupus patients. Any transplant can fail by itself, just like a rocket launch. Transplant can fail by itself because of the procedure, but in lupus there is a small risk of getting the lupus nephritis. Transplanted kidney also may get a lupus nephritis, and that also can fail in a rare cases earlier on. But nowadays it doesn't happen because good drugs are available.
Yeah.
Okay. So generally I have not seen anybody lupus who's transplanted going into problem again. Okay.
Okay. Hmm.
So because of medication, not because of doctors or something, good medication, good immune suppression. So if at all you get a transplant, you have to be little, how do I say it? You have to be little apple about it. Apple. I don't know how to tell it. You have to go to a good center, though very expensive.
Ah. Yeah.
Though may be expensive, you have to go because it's a skill procedure. Both transplant is a skill by a urologist, and post-transplant there has to be a transplant nephrologist, not a normal nephrologist who keep doing
Yeah.
dialysis and all. There are some very good transplant nephrologists with a backup of a good hospital.
Ah.
Okay, now rheumatologist may not come into the picture much. It will be
Okay.
between the urologist and the nephrologist, and will depend on the donor's thing, donor's age, donor's kidneys, donor's inherent kidneys, the skill of the procedure, your body's ability to accept it, the kidneys ability, the donated kidneys ability to accept your kidney. There are a lot of findings are there, but India is one of the top people in transplant. Okay.
Yeah.
There are two types of kidney transplant. One is from a living donor, and one is from a cadaver for organ
Yeah.
transplant. So both procedures are there. It's a painful procedure, long procedure. But if you can identify a good hospital, good team, I don't think there's any problem at all.
Okay.
Then what will happen is still you will have to continue medications. Immunosuppression will be stronger. It can be stormy. Drug-related effects may be there because immunosuppression they will do at the cost of saving your kidney. Now, then the nephrologist will want to save the transplanted kidney because they have made lot of effort. You have made lot of effort. Somebody has donated the kidney. So the whole process is there. You will have to go through the process. So the single point is only one thing is whether the patient and donee are willing to undergo the transplantation. In India, the problem is finding a donor. There is only one problem in India. Finance is not a problem. Procedure is not a problem. Patient's acceptance is also a problem. If doctors say they will accept. Patients are very good. But only problem is nobody is willing to give the kidney.
Yeah.
Especially for a lady, but for the gents it is ulta. Because he is the earning member and they will terrorize. Usually the sister gives. Wife may not give. Sister gives or mother gives. But father and brother does not give for a lady generally. Because they have another family. See, if it's a brother brother's wife will not let you have it. You understand? Why should the brother's wife will agree to give for a sister? So there are complicated social issues are involved. So you have to tread carefully and go ahead. If you decide to go ahead, you should go ahead full swing. दिल्ली दौरी नहीं करना चाहिए, मतलब रैपिडली कर देना चाहिए.
Sir, so it must be around more than 40 mg or 50 mg per day, na? Once after immunosuppression.
कौन सा?
जो
ना ना वो अलग अलग है. ना वो अलग है. वैसा कोई भी लूपस में फ्लायर हो जाता है. कभी भी किसी का स्किन फ्लायर हो जाता है या हार्ट फ्लायर हो जाता है, न्यूरो आ जाता है, यू अगेन स्टार्ट विथ 1 mg पर केजी. 1 mg पर केजी कोई बड़ी बात नहीं है, क्योंकि अभी देखो कोविड में क्या हो रहा है, अक्यूट कोविड वायरल इंफेक्शन में हम इम्यूनोसप्रेशन दे रहे हैं. सो स्टीरॉइड्स आर नॉट डरने का कोई बात नहीं. हम पहले जमाने में स्टीरॉइड का डरने की बात है, जब आप नॉन रोमेटोलॉजिस्ट देते थे ना, उसको पता है कितना देना है, कहाँ देना, कब बंद करना है. नाउ दिस ट्रांसप्लांट सब प्रोटोकॉलाइज्ड है, ज्यादा देर नहीं करेंगे, रैपिडली टैपर भी कर लेंगे. अगर साइड इफेक्ट हो गया तो भी आपको बता देंगे, आपको शुगर बढ़ेगा, आपको बीपी बढ़ेगा, आपको वो होगा, सब खुल के बता देंगे. वंस दे टेल यू अपफ्रंट ये सब होने वाला है, and even if you have a side effect, they will manage it.
Okay. Fine, sir.
So this is a permanent renal replacement therapy.
Yes, sir. Thank you.
Anubha, she is asking, I would read her question. I am a SLE class 5 lupus nephritis patient. I was diagnosed with SLE in 2019. That year was very bad for me because of this kidney problem, but 2020 beginning was good for me. I started my job again, started to lead a normal life, and this was the period when my corticosteroid was reduced. Then in the month of September, I started to feel pain in my legs and it got increased with the time. I thought it is happening because I'm leaving my steroids. But when the pain came to an unbearable situation, my doctor advised me for MRI and I was diagnosed with AVM grade 2 in both the hips. Before this problem, my doctor told me that you are fine, you can have a normal life, there is no problem, now you can get married or also. Then after some time, this AVM came in my life and I had to go for surgery. I was not knowing how it happened. Her question is, what are the possible side effects of my lupus medications and could they trigger or aggravate my lupus symptoms?
Number one is the medications will not trigger your lupus symptoms, and for you the fortunate thing is the doctor picked up AVM early, because it's unlikely to be due to steroids, because you are on reducing dose of steroids. Lupus itself in a variety of manner can cause AVM, either by vasculopathy, vasculitis, antiphospholipid syndrome and all that. But steroid is the commonest cause of AVM in lupus. So steroids also cause, disease also cause. Very difficult to differentiate, just like we cannot differentiate between Oppo mobile and Vivo mobile. I can't differentiate between Oppo mobile and Vivo mobile. Similarly, very difficult, but since you are being decompressed and you are doing well, and you may be able to do well, otherwise AVM is usually a bad scene where you have to replace your hip replacement surgery. But since it does not happen in your case, it's a good thing, and we try and minimize the steroids. That's yeah.
Okay, and her second question is, can she get married and can she bear a child as well?
Yeah. If you are in
Should she continue taking medicines while she is carrying?
Yeah. See, absolutely, most of the lupus medications can be continued, except few we don't give, like cyclophosphamide and MMF and rituximab and all that we don't give, methotrexate and all. But definitely we give hexaquase, steroid, azathioprine. So azathioprine is a good medication during pregnancy and during lactation. And if you are in remission for 6 months, 3 months to 6 months, you can straight ahead and become pregnant. There's no problem. And usually what happens is, usually if you are well controlled, don't have a lupus nephritis and all, the pregnancy goes on smoothly if you are under high risk obstetric care and rheumatologist. Both you should do together and face the problem one by one if at all it occurs, but usually it doesn't occur. But after the delivery, if you can have a mild flash, that can be very well controlled. But if the disease itself is not controlled, it is active, then you should not consider pregnancy immediately, but defer it by 3 months to 6 months.
His first question is, when should you suspect lupus nephritis?
Yeah, as I told you, if you are having a leg swelling, or whenever you go for a regular checkup, if your urine has started showing proteins, or if your urea creatinine is rising up, you should, or if your BP is rising up, you should suspect lupus nephritis.
So second question of Hema is, what are diuretics?
Okay, diuretics are drugs which cause urine to go more frequently. It will increase your urine output. So if you have too much of water in the body, to remove it, use it for a temporary purpose. It's not a permanent thing. Just to reduce the load on the kidneys, we use it.
And have another question related to diuretics is, what are the different types of diuretics?
There are 3 or 4 types of diuretics. One is a potassium sparing diuretics, one is a loop diuretic, then the other one is a thiazide diuretic. Okay, these are the 3
Are there side effects of diuretics? Okay. Are there side effects of diuretics?
Yeah. But there are very many side effects, but they are very minor. So one is that it can cause excessive water loss, it can cause electrolyte disturbance, but it's very rare actually to have. But other metabolic side effects can occur, but generally they are well tolerated. Many people are on diuretics, mild diuretics.
Okay. So today we are done with all the questions.
Yeah.
Thank you for joining us. Take care of
Very
yourself.
nicely conducted. Bye.
So thank you everyone for joining us today and learning about lupus nephritis. I hope your queries were cleared, and whatever doubts you had, we tried to resolve those problems and doubts. And we will come back again with other topics. And if you have any queries regarding lupus, you may message us. Even you can join us on Facebook page and WhatsApp group we have, where we talk about lupus, we discuss about lupus, we do enjoy, we do have some funny sessions as well. So just join us and keep motivating us. Thanks for joining.